Hello, everyone. Welcome to Dr. Mark Official. I am Dr. Mark, a medical specialist with over 10 years of experience in the medical field. On this channel, I share trusted medical information, health tips, and awareness topics to help you make better decisions about your health and well-being. If you care about your health and want reliable, professional guidance, make sure to subscribe, follow, and support the channel so you never miss important updates. Today, we are going to discuss a very important and eye-opening topic. Are your screenings hurting you? 5 tests to reconsider after 65. Many people believe that more medical tests always mean better health. But is that really true after the age of 65? In this video, we will explore 5 common medical screenings that may need to be reconsidered and understand when testing helps, and when it might actually cause harm. So stay with me till the end because this information could change the way you think about your health. When we think about medical screenings, we usually think about prevention, protection, and peace of mind. We're told that early detection saves lives, and often it does. But here's an important question we don't ask often enough. Can some screenings actually do more harm than good, especially after age 65? Today, I want to talk about balance. Screening tests are powerful tools, but they are not one size fits all. As we age, our bodies change, our risks change, and the benefits of certain tests may no longer outweigh the potential harms. Let's look at 5 screenings that experts suggest may be worth reconsidering after 65, depending on your personal health history. First, PSA testing for prostate cancer. For some older adults, slow-growing prostate cancers may never cause symptoms. Yet testing can lead to biopsies, anxiety, and treatments that may cause side effects like incontinence or erectile dysfunction. In certain cases, monitoring rather than aggressive testing may be the better choice. Second, routine mammograms beyond a certain age. While mammograms save lives, the benefits decrease for women with limited life expectancy or serious health conditions. False positives can lead to stress, unnecessary biopsies, and overtreatment. The key is individualized decision-making. Third, colon cancer screening after 75. Colonoscopies are valuable, but they carry risks such as bleeding or complications from sedation. For adults who have had regular normal screenings before 75, continuing may not always provide significant benefit. Fourth, bone density tests done too frequently. Osteoporosis screening is important, but repeating tests too often without changes in risk factors may not improve outcomes and can increase costs and unnecessary worry. Fifth, full-body screening scans. These are sometimes marketed as preventive tools, but they often detect incidental findings, abnormalities that are harmless, but lead to more tests, more procedures, and more stress. The important message here is not to avoid care, it's to avoid unnecessary care. Screenings should be based on your personal health status, life expectancy, family history, and values. What's beneficial for one person may not be for another. After 65, the conversation shifts from how early can we detect disease to will this test truly improve my quality and length of life? So what should you do? Many people believe that medical screenings are always helpful and that more testing automatically means better protection. However, after the age of 65, some screenings can actually cause more harm than benefit. As the body ages, it becomes more sensitive to procedures, medications, and follow-up treatments. What may have been low risk at age 50 can carry greater risks at 70 or 80. For example, invasive tests like colonoscopies can lead to complications such as bleeding or reactions to anesthesia. Even blood tests can trigger a chain reaction of additional procedures that may not have been necessary in the first place. Another concern is false positives. A screening test might suggest a problem when there is none, leading to anxiety, repeat testing, biopsies, or treatments that create physical and emotional stress. Older adults are also more likely to have slow-growing conditions that would never affect their quality or length of life. Detecting these conditions can result in overtreatment, exposing patients to side effects without real benefit. There is also the issue of overdiagnosis. Some screenings identify diseases that would never cause symptoms. Treating these findings can reduce quality of life rather than improve it. Surgery, radiation, or medications may carry risks such as pain, infection, fatigue, or long-term complications. In later life, healthcare should focus more on maintaining comfort, independence, and overall well-being. Instead of automatically continuing every routine screening, it is important to carefully consider whether the potential benefits truly outweigh the possible harms. When considering medical screenings after the age of 65, it is especially important to carefully weigh the risks alongside the potential benefits. While screenings are designed to detect disease early, they are not risk-free. One major concern is the possibility of false positive results. A false positive occurs when a test suggests there is a problem when, in fact, there is none. This can lead to emotional distress, anxiety, and a series of additional tests that may be invasive, costly, and unnecessary. For older adults, the stress alone can negatively affect overall well-being. Another significant risk is overdiagnosis. Some screenings detect conditions that grow so slowly they would never cause symptoms or affect a person's lifespan. However, once detected, these findings often lead to treatment. Treatments such as surgery, radiation, or long-term medication can carry serious side effects, including pain, infections, fatigue, or reduced mobility. In some cases, the treatment may have a greater impact on quality of life than the condition itself would have. There are also physical risks linked to certain procedures. Colonoscopies, biopsies, and other invasive tests may cause bleeding, infections, or complications from sedation. As people age, their bodies may take longer to recover, and the risk of complications increases. Even less invasive tests can start a chain reaction of follow-up procedures that expose patients to further risks. Because of these factors, it is essential to evaluate whether a screening will meaningfully improve health outcomes. A thoughtful discussion about risks helps ensure that medical decisions support long-term comfort, independence, and overall quality of life rather than unintentionally causing harm. Health decisions after the age of 65 should never follow a one-size-fits-all approach. Every individual has a unique medical history, lifestyle, and set of priorities that must be taken into account. While general guidelines for screenings provide helpful direction, they cannot replace personalized care. What may be appropriate for a healthy, active 68-year-old could be very different for someone of the same age managing multiple chronic conditions. Overall health status plays a major role in determining whether a screening is beneficial. A person with a longer life expectancy and few medical problems may gain more advantage from early detection of certain diseases. In contrast, someone with serious heart, lung, or other chronic illnesses might not benefit from aggressive screening because the risks of testing and treatment could outweigh the potential gains. Life expectancy is an important factor, as some conditions take many years to develop into serious health threats. Personal values and preferences are equally important. Some individuals prefer to pursue every possible test for peace of mind, while others prioritize comfort and avoiding unnecessary procedures. Cultural beliefs, family experiences, and past medical outcomes can all influence these decisions. Open communication with healthcare providers allows patients to express what matters most to them, whether that is longevity, independence, or quality of life. Personalized healthcare also considers previous screening results. If someone has had consistently normal results over many years, continuing the same tests indefinitely may not always be necessary. Tailoring medical care to the individual ensures that decisions are thoughtful, balanced, and aligned with both medical evidence and personal goals. Open and honest communication with your doctor is one of the most important parts of making smart healthcare decisions after 65. Screenings should not be automatic or based only on routine schedules. Instead, they should be the result of thoughtful conversations about your specific health needs. Asking questions helps you better understand why a test is being recommended and what it may mean for you personally. It is important to ask about both the benefits and the risks of any screening. For example, you can ask how likely the test is to detect a serious problem, whether early detection would actually change your treatment options, and what possible side effects or complications could occur. Understanding the likelihood of false positives or overdiagnosis can also help you feel more prepared and less anxious if unexpected results arise. Good communication also involves sharing your full medical history and any changes in your health. Your doctor may not always know your daily challenges, concerns, or priorities unless you speak up. If maintaining independence, avoiding hospital stays, or reducing medications is important to you, those goals should guide your healthcare decisions. Doctors can only tailor recommendations effectively when they understand what matters most to you. Additionally, do not hesitate to seek clarification if medical terms or procedures seem confusing. Informed patients are empowered patients. Taking time to discuss options allows you to make choices that support your quality of life rather than simply following routine practices. Clear communication builds trust and ensures that healthcare decisions are thoughtful, personalized, and aligned with your overall well-being. Thank you so much for watching Dr. Mark Official. I hope today's discussion on Are Your Screenings Hurting You? 5 Tests to Reconsider After 65 helped you better understand the importance of making informed and personalized health decisions. Remember, good healthcare is not about doing more tests. It's about doing the right tests at the right time. If you found this video helpful, please like, share, and subscribe to the channel. Your support helps me continue sharing valuable and trustworthy medical information with you. Don't forget to follow and turn on the notification bell so you never miss important health updates. Take care of your health, stay informed, and I'll see you in the next video on Dr.